keeping with on. I'm going to confirm that by just having a check. I think that we will be live. That's something different. I think that should be coming live just now. It is. Lovely. Excellent. Oh, yes, lovely. So we've got a couple more minutes. Oh, we've got 15 people already on. That's good news, isn't it?
Very good. Hello.
So I think that as there are quite a few people already logged on, we could make a start. My name is Anna Rigby, I'm the Outpatients Matron, and I'm going to be taking the questions and passing them on to the team, and I'll allow the team to introduce themselves. Jane?
Okay, hello, I'm Jane Upham, I'm the Matron for Inpatient Services, and I'm absolutely delighted to be here with you all today. And here I've got...
So I'm Megan, I'm one of the practice educators, but I have lots of experience working on level 5 and our postnatal ward.
And I'm Flora, and I'm the antenatal ward manager, and I also run the reach service as well.
So hopefully today we'll be able to answer lots of questions in relating to inpatient services, in particular the antenatal ward. So if you need to be admitted during your pregnancy because you've got a complication, then it will be level 6 you will go to, so we'll be able to have a chat about that. Level 6 is also where you will go if you need to be induced. So Flora's going to talk to you about Induction of Labour, what we're currently doing and what we're going to be moving forward to doing in the next couple of weeks. And then Megan's going to talk to you about experiences on level 5 and what to expect in the postnatal period, what happens during the day, whilst you're on the ward, who you're going to see, what you need to expect when you're on postnatal. So quite a broad range of subjects, so hopefully we'll get lots of questions. We're really looking forward to sharing our knowledge and experience with you. So I don't know if there's anything coming through yet, Emma?
Not as yet. We've got 27 people now watching. So any questions that you have for the team here, this is your time to ask.
So I think whilst we're waiting for some questions, I wonder whether Flora would like to just talk a little bit about level 6 generally.
Yes, can do. So level 6 is our antenatal inpatient ward, and you'll come to us if there are any complications that have arisen in your pregnancy that need a closer observation here in the hospital, and sometimes you might also come to us in the early stage of labour if you feel you need a little bit of extra support. So it's predominantly bays. There are a few side rooms, but you would predominantly be coming in and staying in the bay out there with us. And you would be having close contact, obviously, with us midwives, and also the doctors will come and do a doctor round, so you can get information from them regarding your care and what's going on. As Jay mentioned, we also have the induction bay, so the start of the induction process begins up on the antenatal ward. We monitor your baby very closely and monitor you, see how you're feeling, and then we can start that process of induction. That's my feeling about the ward.
And we quickly sort of talk about visiting hours.
Visiting hours, yes. So visitors are welcome for the inpatient. So visitors, 2 visitors can come between the hours of 8 in the morning and 8 in the evening. We do ask that you do a lateral flow before you come, and that you actually bring the cassette and show us the cassette. And that's just obviously just being mindful of COVID. throughout the unit. When you come as an inpatient into our ward, we'll also ask for your lateral flow, but we will also ask to do a PCR test, and that just gives us a more accurate, longer-term result for COVID. I think another question that comes up quite a bit is meal times or food up on the ward. You are allowed to eat when you are up with us. We will have somebody comes around the ward every morning. We'll show you the menu, take your order. But sometimes, just because of, depending on the time that you were admitted onto the ward, or if you've not been there for long enough, you might miss out on ordering first thing in the morning. But we have like a 24-hour service of food that you can order through our Light Bright menu. So it's really important that you let us know if you haven't had anything to eat, because pregnant women do need to eat, you need to keep your energy levels up. So we can order anything for you at any time of day, so just ask.
We don't have a facility to heat food, but if your visitors want you to bring any snacks, or they want to buy you stuff from the shops that are on site here, that's absolutely fine for people to bring in food for you. But as I say, we don't have facilities to heat up food for you, but we often see people with takeaway drinks and snacks from the local shops. That's absolutely fine as well.
I passed some part of bringing fish and chips the other night. Oh, that sounds lovely.
Just before lunch, that's making us all a little bit hungry.
So I've had a first question come in, and this is from Annabelle. So Annabelle's heard a few things about level 5, perhaps about the support that's offered, and with breastfeeding and just in general. So she's just wondering about, with some of the feedback that has been given over time, are there improvements being offered with support being given? How are we looking to
so it's important to say that all staff are trained to the same standard of breastfeeding, or any advice in terms of feeding methods that you would like to do. So in terms of the staff that we have on our postnatal ward, so we have the midwives. We also are really fortunate that we've got some obstetric nurses. So these are nurses that are here to support us, and also our support workers and our maternity associate practitioners. So we all have a feeding training day when we first start, and yearly updates, so that we're all able to give you the same advice. It is important that if you want some feeding support that you let us know, because unfortunately we are a 41-bedded bay, so we aren't able to know exactly when you're needing to feed. But we do come around regularly to check how the feeding's going and offer our support throughout the day. But again, like I said, if you feel you need some extra support, then you can let us know, and we're able to help you.
I also think it's a really good idea to get as much information before you actually have your baby about infant feeding. So I'm sure if you're regular visitors to this site, you'll know that the infant feeding team on a Thursday do a regular infant feeding session. It's really useful to log into that to get information. There's lots of information on the intranet. Your baby app should give you information about infant feeding. So the more information you can have before you actually have your baby will just give you, will empower you ready for when the baby's actually born. And I think Flora will probably add a bit more about antenatal expressing.
I was going to say as well that, obviously, again on level 6, the antenatal ward, we can support you with talking through hand expressing. Obviously, we wouldn't recommend hand expressing too early in a pregnancy, but we have a look at the clinical picture and really help and support you. We'd certainly give you lots of information anyway with that, so just ask.
And as Megan rightly said, that all the staff on the ward are trained and able to support you with both breastfeeding and bottle feeding. If you are more complicated, if you need to be readmitted because of feeding problems, or you have a baby that's premature that's on the ward, then we do have the infant feeding team that can support. But that isn't for everybody. Everybody can be supported generally by the midwives, nurses, support workers, and assistant practitioners that are on the ward. Very much want to do that to help you.
Annabelle, I hope that answers your question and reassures you. So Kate has contacted us to say that she recently had a stay on level 6 and everyone was really lovely. So that's great. It made her feel much more relaxed in preparation of giving birth. and she is due to be induced later this week. What happens on the day of induction? Kate wants to know.
Okay, so on the day of your induction, you'll come to us, and we have a dedicated bay, an area where we will obviously go through your notes, make sure that we're fully aware of the reason for your induction, and then we'll monitor your baby, and then talk you through the different processes. There are various different ways of starting an induction, and we would discuss which one would be appropriate for you at that time. And then when you come into induction, we would expect you to stay here with us, and that's so that we can monitor the baby and make sure that that you are then going into labour, and if not, then we have other things that we can do to encourage that labour process. What I would say is that it is quite a lengthy process. Induction isn't very quick, so be prepared to stay here for a little while. And when your labour starts progressing, or if we need to do further intervention, it's at that point that we'd have a discussion with delivery suite and organise moving down to the delivery suite. But the majority of your stay will begin up on level 6 with us.
Okay, thank you. Kate, if there's anything further you do want to ask, then obviously do speak to your community midwife, or we're on for the next 55 minutes if there's any other questions. Hazel's popped a question in to the chat. She's asking if her husband can come with her when she comes for her induction, and can he stay overnight? And if he can't stay overnight, what if the baby comes overnight?
So he can come to the induction. So our visiting hours are between 8 in the morning and 8 in the evening. We don't have visitors staying overnight, so he would have to go home at that point. But when things start to progress, or if you're going down to delivery suite, then we give him a call and tell him to come straight back. So when you're here on delivery suite, he'll be here with you if that's what you'd like.
Hopefully that reassures you, Hazel. There's no other questions at the moment, so if you are watching and have a question, then do please pop it into the chat. And the expert panel will hopefully be able to help you.
So I think whilst we wait for some more questions, Megan, would you like to talk a little bit about what happens on level 5 when you arrive?
Yeah, so level 5, like we said, is our postnatal ward, so that's the ward that you would attend if you were needed to stay in after having your baby. This may be because you and yourself need observations, or your baby requires some more monitoring. So we are a 41 bedded bay, a mixture of side rooms and bays. Most of our women do go into the bays rather than the side rooms, as we only have a few side rooms, so it's a case-by-case basis. The bays, there's only 4 of you in the bays, and for example, your baby had to go to the neonatal unit, and then we try and put you in an allocated bay with other mums with their babies in the neonatal unit. This is just to allow you some time to be able to sleep, because it's quite stressful having a baby down in the neonatal unit. The staff that are on level 5, so as we said, we have midwives, nurses and support workers, but we also have daily doctors that come round to do the ward round. So if you had any complications and you needed to see a doctor, they come round throughout the day to make sure you're okay. We also, again with the meal times, our meals are exactly the same, so we provide yourselves with breakfast, lunch and dinner, but again if you're hungry throughout the day, we do have a 24-hour service, so you just need to ask from the midwives or anybody on the ward, and they'll be able to help you with that. So our visiting times are again similar to level 6, so they're 8 a.m. in the morning, 8 till 8 p.m. in the evening, and again we like to ask that you do a lateral flow before coming to visit. So we are now allowing 2 visitors on the ward now. but we do request that the second visitor is the same person that attended you in labour. And this is just to minimise the risk of bringing COVID into the hospital, especially because we do have quite vulnerable mums, and obviously with babies as well, that's added vulnerability. We, as we're saying again, unfortunately we can't provide food for any visitors, but there are local amenities on site that you can go down to get them. But we do try and ask that visitors minimise their going in and out, just to, again, limit the flow of traffic on the ward. So daily things that happen is, so we have our shift change starts around 7:30, when we hand over from either the night to the day or the day to the night, and then the midwives and nurses will come round and say hello to you. They'll do normally a set of observations just to check that you're okay, and a check in terms of how you're recovering post delivery. If you require more monitoring, then we might be doing observations a little bit more regularly. We tend to do them at times like 10 o'clock, 2 o'clock and 6 o'clock. And they're the same with pain relief as well. But again, if you needed pain relief and we haven't outside those times, then we just ask you to buzz and let someone know, and they're happy to support you with that.
I think it's just because you've mentioned pain relief. I think it's really important that you take pain relief regularly. I think sometimes you think, oh, when you offered it, you'd feel okay at that minute. But actually, if you've been prescribed pain relief, it is really advisable to take it at regular intervals, which then should minimise the amount of additional pain relief that you need. However, if you do need additional pain relief, it's absolutely fine to call for that, and we will give you additional pain relief as required. I think it's useful to know as well to have pain relief ready at home, paracetamol, ibuprofen. So that's all there when you get home, because it'll be the last thing on your mind after you've had your baby to get that sort of thing ready.
And also that applies, before you've had your baby. So if you come to us on level 6 in early labour, and if you need pain relief, then please do ask for it. We do have it, and we can give it to you. We will give it to you. But just please ask us.
Is that a good place to stop? Is there more questions?
There is.
Thank you. So Hazel, who asked us earlier about her husband coming in, has thanked for the response, but also wants the confirmation of where to go for induction.
Oh, sorry, I didn't make that clear. So come and see us on level 6 of the Women's Centre, so where you would go for your scan, you go to level 4, but just carry on in the lift up to 6, and then our ward clerk will greet you when you arrive. She will ask just to quickly weigh you so that we can calculate any medication for you correctly, and then she'll take you down to the induction bay. She will ask to see those cassettes with your lateral flow, and then we will take things from there. We'll tell you where to go, don't worry.
Thanks, Laura. Kaylee's got a 2-part question. The first part is she's asking, are you still allowed 2 birthing partners?
Yeah, as far as I'm aware, yes, at the moment. You are allowed 2 birth partners, yes.
2 birth partners, 2 visitors when you're inpatient, but it's probably a good point to remind people that if it's an outpatient appointment that you've got, so an antenatal clinic appointment, scan appointment, that's still just 1 visitor. If you've got an appointment with the breach team, then Flora will update.
Yeah, that's one
person. Yeah. So generally speaking, outpatient appointments it's 1, inpatient and labour it's 2 visitors.
And with the inductions, we start off with 1. When you come in for your induction, the majority of the time you will probably stay in, but there might be occasions when actually after a clinical examination it isn't appropriate for you to be staying in, and actually your induction process can be continued at home and then continue the next day. So for that reason we say just one partner with you for that induction appointment, and then when you stay as an inpatient, that second visitor can come.
Thank you. And Kaylee just wanted to check what the difference was between level 5 and Silver Star.
So Silver Star is our obstetric service that you're referred to during the antenatal period. So most women that are under Silver Star, once they've had their baby, still goes to level 5, but generally they'll be seen by one of the Silver Star team because they are aware of their care. So we still have them on level 5, but there's not a difference once you've had your baby.
So all postnatal after delivery will either go to level 5 or occasionally you might go up to Aspires on level 7. But the majority of women go to level 5 post-delivery. There are no women on level 6 that have had babies.
I hope that clarifies that, Amy. So we're up to date with questions at the moment.
So I wonder whether Megan would like to continue about who you might see in relation to all the different checks that need to happen when you're on level 5.
Yeah. So as I was going through the checks, there's a few other checks that we need to complete prior to you going home with your baby. So the baby will have a newborn check. You might have heard it's called the natal. And this check needs to be done in the first 72 hours from having your baby. And this check includes looking in their eyes, checking their heart, and make sure there isn't any deviations, looking at the hips, and they're able to then refer as needed. So this generally is carried out by one of the midwives who's running the NIPE clinic. So they've had extra training to do this. But again, if your baby was premature or there's another reason, then they may be seen by the SHO. So on the team we have our ANMP, so these are specific nurses who are trained to be like a doctor from the neonatal unit. So if you're, like I was saying, if your baby's born a little bit earlier than 37 weeks, then they would see them. Or if they were born with a lower birth weight, they may be seen by the ANMP or a neonatal doctor. We also have the newborn hearing team. So every baby, we like to do a hearing check. Some babies have this done prior to discharge, and some will have that in community. And this is just a check to make sure that the baby's hearing is okay. So they're on team are on the ward as well.
So along with the people that Megan's mentioned, you may also need to see a doctor when you're on the ward. Somebody's mentioned Silver Star, high-risk pregnancies. So before you could go home, you need to be reviewed by the medical team. Sometimes you need medication to go home with, so that needs to be arranged. So hopefully you're already getting a picture that once you actually get to the postnatal ward, before you can actually go home, there's quite a lot of people that you need to see, quite a lot of things that need to happen. So this means that the process of discharging can sometimes take a bit longer than you would perhaps have anticipated. So we just ask you to bear with us, to be patient. We try to do everything as quickly and as efficiently as possible. Because we know that the best place for you once discharged has been agreed is for you to be at home. So we are looking at ways to improve the process even more. We're continually trying to update our processes, and we've got a little team working at the moment to see how we can get discharges done in a more speedily fashion so you can get home to your families much quicker.
I think we've got another question come in, and this is from Hazel. So hopefully Hazel, we're helping you a lot with those questions that have been there. Thank you. So Hazel wants to know about pain relief during induction. Can she have an epidural, but she does, however, want to be mobile and not too numb on her legs?
Okay. So I think so in terms of pain relief, we can offer all sorts of pain relief throughout the different stages of labour. For the induction of labour applies to the beginning, the start of things. As your labour progresses and you move down to the delivery suite, then you might feel that you need an increase in pain relief. But for the initial induction of labour, when you're up on level 6, we find that most people don't need anything to start with. Some people might find the examination, so we do a vaginal examination where we assess your cervix with our fingers to find out what will be appropriate in terms of induction. Some people find that quite uncomfortable. We do have gas and air, so we can provide you with that. But generally people find they don't need a huge amount more. But like I say, as things progress and as that labour progresses, absolutely, if an epidural is on your list, then we can get the anaesthetist to come and have that discussion with you. If you find that you're needing that much pain relief, then we need to make sure that you're in the best place, which probably isn't the antenatal ward. If you need that much pain relief, then you should be down on delivery suite, where our anaesthetists live, and they'll be able to administer the epidural as you want.
Thank you. We're up to date with questions at the moment. We've got 23 people watching us. I know we've got some members of staff watching as well. So this is the time to ask questions. If you have any questions that you've not had opportunity to discuss with your community midwife or your consultant team, then this is the time to ask our panel of experts any questions that you have on inpatient services or the processes involved with induction. Or breech babies, if you've been found to have a breech baby at 36 weeks. Our specialist breech midwife here, so any questions or queries about breech. Oh, got a couple more questions popped in actually. Kate is asking, how do we decide the best way to be induced?
So there are various different options, and a lot of it will depend on if you've had a baby before. Our first line that we're offering is to offer a hormonal gel, which will ripen your cervix and encourage the cervix to be to start the process of labour. A lot of people who've had babies previously, their cervix might be in a different position to be starting labour, and it might be that actually all we need to do is to try and break your waters, and when your waters have broken and your baby's head comes and presses down hard on the cervix, that's enough to encourage the established labour. But so everybody is different. So what we try and do is do that examination and have a discussion with you. We'll recommend our first line and then take it from there. So.
I think probably it's just quite open-minded.
Yeah.
And now when you come in, as Flora said, an examination will take place, and then a very open conversation will happen with you, and between you, you'll make a decision about what the best step is next, but you'll be very much involved in that decision-making process, and it'll be very clearly explained to you the advantages and disadvantages of each method. So I think just to be reassured that open conversation where you'll be involved in the decision-making will take place.
I think, I don't know if it's I've talked about the beginning of induction, but actually what most people kind of hear and know about is the hormone drip, and that's what everybody, kind of hears the most stories about. And I think that there are different ways to start the induction process, but the main form of induction, is giving you a hormone drip, which is a synthetic oxytocin, which will encourage your uterus to start contracting. And that's what we're kind of aiming towards, to encourage your uterus to contract, which will in turn hopefully encourage your cervix to open. So that the beginning process that Jane was talking about is how are we best going to get your cervix to a position to start that contracting process.
Okay. The next question is from Jodie, who's booked in for a cesarean section a week on Friday for her twin girls. Jodie wants to confirm, can she have 2 people at the hospital with her, but only 1 in theatre? Is this correct?
Yes. Yeah. So you can have two visitors, but unfortunately we can only facilitate 1 person in theatre with you, just because there's going to be quite a few members of staff, especially as you're having twins. So we tend to have enough teams for each baby. And obviously there's going to be the theatre staff and the doctors and the midwife in theatre, so it can get quite busy. So just for safety reasons, we only have one person in theatre. But once your babies are okay and everything's all right, then once you're out of theatre, then yes, you can have another person with you.
I've just realised we've missed out a whole group of staff that you will meet who are actually really valuable to us, and that's our student midwives. So throughout your entire journey, from the antenatal wards, delivery suite, postnatal ward, and you probably already met student midwives out in the community. They're a huge, valuable resource to us. Obviously they're learning and developing their skills, but they provide a huge amount of care to the women and families that use our service. So yeah, we really must remember that as student midwives, how important they are, and that you will meet them throughout your journey.
But they're not. But they will always be with a midwife.
So
you will always have the care of a midwife, but she might be working with a student midwife.
And if you really, really do not want to have a student midwife involved in your care, then you just need to let your midwife know, and that request will be honoured.
Okay, so Danielle has messaged in saying, is it possible not to have a vaginal examination when in labour and arriving in the hospital? Is there another way of finding out how established in labour she is? It's her second baby, and she has pelvic pain and found it incredibly uncomfortable first time around.
Well, I think I can't stress enough how much I want to say that a vaginal examination will only ever be performed with your consent. So if you don't give consent, we will not be doing a vaginal examination. The reason that we offer it is so that we can gain an understanding of the clinical picture, to know, how far in labour someone is progressing. But there are other ways of assessing a labour, especially if you've had a baby before. Then it might be appropriate to just wait to support you, to observe you, and to observe other external clinical signs of full dilatation and the baby making an entrance into the world. But if we think it would be appropriate to perform a vaginal examination, that would only ever be after a discussion with you and with your consent. That would be my main message is consent.
And actually they only tell us what's there. That may, especially if you've had a baby before, your cervix could be essentially nothing, and then very quickly you'll be having a baby, so it doesn't always give us a very clear picture of what's going on.
There might be, so if there are concerns about your baby's well-being, then we recognise that a vaginal examination to know what the cervix, what position the cervix is in, is beneficial, because it will determine what clinical action is then taken. So if your baby is very distressed, then should we be offering you a Cesarean section? Well, if you're 1 centimetre, that might be more appropriate. But if you're fully dilated and your baby's actually very close, then we would like to veer away from the Cesarean section. So again, it's all about getting that clinical picture to make the safest decision all around.
I think as well, you talked about how painful it was first time around, is to make sure you've got some pain relief available. So Flora's already mentioned gas and air, that we're using the induction bay. Again, this is something that you can have during an examination if you consent to that and that feels like the right thing for you.
Maybe something you want to talk to your community midwife about as well, Danielle, so you could set up a plan which is individual for you, and get some things written down in your notes which may help and reassure you. I hope that helps. Hazel has asked us, she's 36 weeks and 3 days today, and she's been advised by the doctor that she'll be induced at 39 weeks of pregnancy. when would she know the exact date for her induction, because she hasn't been given a date yet?
So the induction date. So the doctors will make give advice as to when the induction should happen, and they normally give from 39 weeks, I guess is what they've been saying. As you can imagine, the women are having babies all the time, and our induction appointments are predominantly quite full, I would say. But as people have babies, then obviously that will free up appointments. But that does mean that we're not always able to give an appointment, weeks in advance, because we just don't know what will be available at that time. We have a referral system, and we check that every single day. We go through all the referrals that have been sent to us, and then we also check through all of our appointments. We go through all of our appointments and see who's had a baby, and therefore freeing up some space. And then we're able to put those referrals into that space. And so as soon as we are able to, we will give you a call to let you know exactly when you should come into us. But if you're 36 weeks and 3 today, and you're going to be induced at 39 weeks, I suspect you might not hear from us for a little while, probably be closer to that in your 38th week that you'll hear from us.
It could be worthwhile as well, Hazel, checking with your community midwife that referral has gone through from the doctor, because there needs to be an actual referral made, and sometimes in very busy clinics or in MAU, if that was where the decision was made, sometimes the final paperwork isn't always sent through at that time, so it could be worthwhile just checking with your community midwife that referral is there on the system. Thank you. So Danielle, who asked earlier about the examinations, has thanked you very much for the answer. That's good. So we've got another question come up. Taya has asked, when measuring ahead in pregnancy, so she was measuring 37 weeks at 34 weeks of pregnancy, is it recommended an earlier induction, or does it suggest a bigger baby and that you should try and go full term?
So if she's measuring 37 weeks at 34 weeks, then everyone is referred to a growth scan at 36 weeks. And when we're measuring in community, when we're measuring antenatally, we're wanting to see, like a growth of the uterus and therefore the baby inside. But it's the growth scan that will give us the most information that you'll have at 36 weeks. From there, if your baby is measuring on the larger side, then it might be worthwhile that you'll be offered a glucose tolerance test, just to see if there's anything going on with metabolizing of the sugars and insulin and things. And we don't routinely induce for large predates babies, but if your baby is showing signs to be on the larger end of the scale, there might be something else going on, which is why we check for the diabetes. So.
Hopefully that helps. I think that was all the questions. Yeah, so Taya, you're 35 weeks at the moment, so you're still waiting for your 36-week scan. There will be more answers.
So there'll be, much more information from that scan.
So Victoria has messaged us. She's hoping for a water birth, but is concerned that the birthing pool is out of action at the moment, and she's got about 4 weeks until her due date. So that's part one. Part two, the question, can siblings visit on the postnatal ward? She's got 3 boys who will be very eager to meet their sister. First of all, about a water birth.
So I'm assuming we're referring to the pool on delivery suite. I don't know at the moment when that's going to be mended. I haven't had an update. So unfortunately, I can't reassure you to say that the pool will be available. I'm presuming you've mentioned the one on delivery suite because that means you can't deliver on the spires. If you can birth on the spires, then those pools are available. So we're doing everything we can to resolve the issue in relation to the birthing pool on delivery suite. At the moment, we are not able to facilitate any children visiting the maternity unit at all, whether that's antenatal appointments, outpatient appointments, or inpatient stays. So the 3 lovely little boys, who I'm sure are very, very excited, will be able to meet their sibling, obviously, when you get to go home.
Thank you. Hopefully that answers your question, Victoria. Hazel, who's asked some fabulous questions so far, has thanked us and found it really helpful. So Elsie has messaged us to say that she's 30 weeks pregnant and just starting to realise she actually has to give birth in 10 weeks. And that's not unusual, Elsie. But she's not actually managed to watch any birthing videos or attend any antenatal classes. Can we suggest any videos or pages to follow to settle her mind slightly regarding anxiety around giving birth?
I wonder whether or not it's best if she speaks to her community midwife, because they will be able to give very up-to-date information about what they're currently recommending. And I think that probably I'd feel happier if she spoke to the experts and the community midwives in antenatal education, and I'm sure they'll be delighted to offer support and help.
Taya, who asked us the questions earlier, has confirmed she has got a 36-week scan booked in for next week, and so she'll hear more then, and has thanked us for your answers, so that's great. Right. We're up to date with questions at the moment, so for the 29 people that are currently watching us, if you do have any further questions, get them in. We've got around about 25 minutes left, so don't run out of time with asking a question. We've got a team of experts here, so anything about inpatient services, do please just put your question on the chat.
I thought it might be a good opportunity just to talk a little bit about mobilisation after you've given birth. I think sometimes it comes as a bit of a shock. You've had this long labour, you've given birth, you're exhausted, you're hungry, you want to sleep, all of those things that are really, really normal, and then suddenly a midwife's coming to you and asking you to get up and walk around. It's really important. We will be encouraging you to mobilise quite soon after you've given birth, and that includes even if you've had a C-section. It's really important that you do mobilise. We know that it's incredibly dangerous to not mobilise after you've given birth in relation to deep vein thrombosis. So I think it's just about being pre-warned and you knowing that a midwife or a support worker, somebody will be saying to you, can we try and get you out of bed, can we try and get you to the bathroom, can we help you with showering? If you feel a bit wobbly and a bit shaky, you don't feel if this is something you can do on your own, and it's outside that visiting time, then we'll be very happy to help you with that. Please just ask, please just say, actually I'm still feeling a little bit wobbly, I'm not quite sure, so we can give you some support with that. The other thing that's worth knowing as well is we often get feedback saying that your beds weren't changed as often as you'd hoped. If you feel that you're in bed and you feel that your sheets need changing, often we can't see soiled sheets because you've got your bed covers in or over. If you would like your bed changed, whether that's in the antenatal period or in delivery suite or on postnatal ward, please just ask. We'd be more than happy to come and strip your bed, give you some nice fresh sheets. It makes such a difference when you get into a bed that it's lovely and clean. And again with gowns, if you feel as if you're not ready to put your own clothes on, your pyjamas on just yet, and you just like a fresh gown, please just ask. We're really, really happy to supply you with fresh gowns. And same goes for your baby's bedding in the cot. If your baby's been a little bit sick or you've had a little bit of an accident and you're struggling, you're thinking, I'm not sure where the sheets are, just buzz and we can bring you some fresh sheets for your baby's cot, or we can show you where they are if you are up and around. Often because we're so busy and we're running around a lot, we don't spot these things, so we really need your help to point us in the right direction if you do need anything.
I think also that extends to bathrooms and things. Sometimes people report to us, the bathroom's been used and it hasn't been washed. It might just be that the domestic hasn't quite got there to it yet, or just please tell us and we can action that quickly.
And I know Megan's talked about food, or both Megan and Flora have talked about food, and the same goes for water. If your water jug's empty, we replenish them each day. If your visitors are there, then we're really happy for them to refill your water jug. If they're not there, or it's in the evening, and you don't feel that you're quite well enough yet to go and get the water yourself, just ask, and we're very happy to replenish your water jug. as needed.
Each ward, apart from delivery suite, each ward have a water fountain that is accessible by visitors or yourself if you're happy to have a little bit of a walk around the ward just to keep mobile.
It fits in with the mobilisation that I was telling you about earlier. But both wards have got tea, coffee making trolleys that you can help yourself to tea, coffee, squash as needed. And if you feel that you can't make it there yourself, then we're happy to get drinks for you if need be. We just need you to ask. It's absolutely fine. You will be offered drinks and food, as we've said, at regular intervals, but sometimes, as both midwives have said here, you might have just missed a drink round, or you were busy feeding, or you were in the bathroom. Please just ask. We're really, really happy to give you drinks and food.
A couple more questions come in. Jodie's asked a question about her scans with her twins, and has given quite a detailed description of the different scans that she's had, and has raised some concerns as to whether she should have some further scans. I think the best thing to do, Jodie, is to actually contact fetal medicine department and just ask the questions, because it's quite difficult to give information, the correct information, not seeing your records here. So the suggestion would be is contact fetal medicine. If you're unable to get hold of them, contact your community midwife who will send in the questions. If you're unable to do either one of those, can you just drop us another message and we can find a way to contact you? And obviously don't put your details onto the chat, but drop us a message and we will find a way to contact you. But my suggestion would be go directly to community midwife or contact fetal medicine. I hope that helps. We've got Elsie, who's asked us, should she bring in formula in case she's unable to breastfeed for any reason?
So we do have formula on the ward, so it's entirely up to you. To say with the formula, all brands are the same. There is is it on Thursdays?
Yes.
There is on Thursdays a Facebook Live with the infant feeding team, and they give really good information about anything feeding. But we do have formula on the wards. Unfortunately, we don't have facilities to make up the powder formula. So if you did decide that you did want to bring your own formula in, we would recommend bringing in the pre-made stuff. But we do have available. We do have a few brands on the ward that you can have. And that's another thing in terms of what to bring. I was just thinking in terms of for your baby, unfortunately we don't have enough stock to provide everybody with nappies. So we do recommend that you bring enough nappies in, so a bag is probably about enough. And obviously if you're having to stay in longer, then your visitor can bring some more in. But yeah, unfortunately we're unable to provide nappies.
And the same goes for sanitary products as well. When you need to provide your own sanitary products, we have a small number that we can give you in an emergency. So please, if you suddenly find yourself you've run out of anything before your visitors arrive, please ask. We're more than happy. We do have a small supply to share whilst you're waiting for your own supply to come in.
And Elsie, as I said, it's brilliant information, all noted, and thank you. So we're up to date on questions at the moment. I'm aware that we're coming to our last 10 minutes, 10-15 minutes. So if you do have any questions, do please pop them on the chat now. And that's anything about your antenatal care, your postnatal care. And as I said earlier, we do have our breech specialist midwife here. So any queries about if your baby is breech, Flora will be able to help with that. So do get your questions in on these last few minutes.
I just want to mention a service that we've had probably in the last year on the postnatal ward. So we're very lucky that we have a team of midwives that run the bladder care service. So if for any reasons you had problems antenatally or postnatally with your bladder, then we are around to support midwives with that.
I can also mention at this point that very occasionally after you've gone home from the postnatal ward, you might have to come back. Occasionally when babies go home, they don't gain as much weight as we would have liked them to, or they've lost a larger percentage of weight than we would accept as a normal loss. or occasionally a baby becomes jaundiced that requires some phototherapy treatment. So both of those things would require you to come back to the postnatal ward. This is obviously quite upsetting for you. You've just got yourself home, you've got yourself settled, and then you're back in the hospital. So we do understand that it is upsetting for you. You'll be supported with that, you'll be given the information, plans will be put in place in order to rectify the reason why you've had to come back in. And we obviously aim to get you back home again as soon as possible. I've mentioned 2 baby reasons for you being readmitted. Occasionally you need to come in because you're not well yourself, your blood pressure might be raised, you might have an infection. If you did need to come back in because of problems with yourself, then obviously your baby comes back with you and would stay with you during your stay.
We're up to date on questions. We're going to continue to do these Facebook Live sessions once a fortnight, where we're getting different teams from the hospital and community to have a chat and answer your questions. If there is anybody in particular that you wanted to see presenting, please do comment on the MVP site and they'll pass those comments on to us. We're trying to get as wide a range of professionals as we can on here to help, but there's probably going to be other people that you're thinking, gosh, it would be really nice if we could have a chat with them. So do please send your comments and any requests for speakers to the MVP, and they will let us know.
It's probably worth mentioning as well, when you're on the postnatal ward, that the midwife or nurse that's caring for you will be caring for up to another 8 women and babies, as well as yourself. So sometimes it takes a little while for her to get to you, to give you the support that you need. She will be working with other members in her team, so maternity support workers and student midwives. But again, sometimes we do ask you to be patient whilst the midwife gets a chance to come and see you. I think when you're on delivery suite and you're being looked after by one midwife, it becomes a bit of a shock when you realise on the postnatal ward you're not being exclusively cared for by one person, that she does have quite a few other women to look after as well as you. But she's more than happy to help with anything that you want, so please just ask. I hope that's the message we're getting across today. Please just ask if we're not doing something that you would like us to do. We're very, very happy to support you.
So Jodie's popped a message in, providing all is okay with mum and baby, or as in her case, babies, how long on average do people usually stay in after a caesarean section?
So it will really depend on how well your recovery is going. It will depend on how many weeks your babies are born at. Sometimes with twins, they do deliver you slightly earlier than someone who has one baby. So if your baby's born a little bit earlier, so under the 37 weeks, then we do recommend that you stay in to at least day 3. But most women, if all's gone well, will go home the next day.
Yeah, and it's very variable. As Megan says, we try to get people home the next day, and that goes for whatever type of birth. If you've been admitted to the postnatal ward, but if there's complications for yourself or your babies, then that stay will be as long as it needs to be.
We want to make sure as well that you're happy with the feeding as well, so that you don't come back to us.
Yeah.
Yeah, we try to get everything in place. But a lot of women now that have an elective C-sections are home by the next day. That's what we aim for.
Yeah, probably by the evening the next day.
As long as there's no complications.
Victoria has asked, do we have to wear face masks in delivery or around the hospital?
So not in deliveries in your room or delivery suite, or so if you're in one of the inpatient areas in your bay area, but we do like you to wear it around the ward, or if you're walking around, just as a part of our protection of all our vulnerable people.
All of our staff are still wearing face masks. We're socially distanced, which is why we haven't got masks on now. We've positioned ourselves with our open windows, and it's a large spacious room, but the ward areas are quite small, so all of our staff that you come in contact with will be wearing face masks.
Well, we do ask that your birth partner wears their mask as well all the time. And we know it's horrible, but keeps us safe.
Yeah, and if you see if you see a staff member not, then please do report it, because it is really important that as staff we are protecting you guys as well.
We've got 17 people watching at the moment. A couple of people are saying hello, so hello to Wendy who's watching us.
Hello.
And we're on the last few minutes if there are any final questions. And if not, I'm going to go around the panel and just ask if there's any final points that you wanted to make. Megan, do you want to start if there is anything you wanted to say?
No, just we look forward to meeting you all when you come in and have your baby. Or babies, I should say.
Jane?
No, I think I've covered everything that I'd hoped we would cover today. It's really great to have this opportunity to share what happens on the antenatal and postnatal wards with you. So thank you for taking the time to join us.
Just before I come to you, Flora, someone's taken the opportunity to ask a question, which is great. How long can your partners stay with you after delivery?
So whilst you're on the delivery suite and in your delivery room, your partner can stay for that duration. When you move to the postnatal ward or observation area, if it's between 8 a.m. and 8 p.m, then your partner can go and stay till the end of visiting. If you move to the postnatal ward or observation area after 8 o'clock, then your partner will need to go home at that point.
Hopefully that answers your question, Taya. Flora, any final things you'd like to say?
I don't know that there's anything to add about the antenatal ward. I think we've covered most things. The induction process is we'll do it together, we'll talk it through together, and hopefully you'll have your baby spontaneously and won't even need to come and see me. It'll be lovely to see you when you do come.
And thank you, Emma, for keeping this flowing really nicely and for sharing the messages on the message board. It makes such a difference that we don't have to keep reading them. So thank you.
Thank you. And I think the final point is something that's been really said time and time again in this last hour is if you have any questions, anything at all, just ask. The team are there to help you, whether that's antenatally, postnatally, outpatients-wise, or your community midwife. Just ask the questions. You never have a daft question because these questions will have been asked numerous times before, but never feel that there's no one to go to because there is always somebody to ask. And I think that probably draws us to the end. So thank you so much for your patience with us and for taking time out to listen to us, and we'll see you in a couple of weeks' time.
Thank you. Goodbye, everyone.
Bye.